The Crohn's disease started when I was 19, but no one believed me until I was 24 and my colon perforated in a Starbucks bathroom. That's the thing about invisible illness. It stays invisible until it suddenly, catastrophically, isn't. My sister Lauren was finishing medical school when it happened. Top of her class, interviews at all the best programs, destined for a prestigious surgical residency. She'd spent 4 years telling me my stomach issues were anxiety and poor diet. The perforation happened on a Thursday. I was meeting a client, felt the familiar cramping, excused myself to the bathroom. Then came pain so severe I couldn't stand, couldn't breathe, couldn't do anything but collapse on the floor tiles and scream. Someone called 911. I remember the ambulance, the ER, someone cutting off my clothes. I remember a surgeon's face swimming above me. We need to operate now. Your colon is perforated. Do you understand? I didn't understand. I understood nothing except pain. I woke up with a colostomy bag and 30 staples holding my abdomen together. Dr. Rachel Kim, the colorectal surgeon, explained it while I was still groggy from anesthesia. You have severe Crohn's disease. It's been active for years based on the scarring and inflammation. The perforation was from an area that had likely been diseased for a long time. We removed 15 centimeters of your colon. Years. Yes. Did you have symptoms? Bleeding, pain, diarrhea? I told my doctor. Multiple times. They said IBS. Stress. Diet. She made a note on her tablet. I'm sorry they didn't catch it sooner. We'll get you to a good gastroenterologist. You'll need medication, monitoring, probably surgery in the future to reverse the colostomy. My parents arrived 6 hours post-op. Lauren was with them, white coat over her arm, stethoscope draped around her neck even though she was just a fourth-year student. Well, Mom said looking at the 4 poles and monitors. This is dramatic. I was too exhausted to respond. Lauren peered at my chart without asking, without permission. Emergency colectomy. What did you eat? What? To cause a perforation. Did you eat something bad? Street food. Lauren, I have Crohn's disease. She laughed. Not kindly. Crohn's? Tessa, you don't have Crohn's. You have anxiety-related GI issues. I've been telling you this for years. The surgeon said. Surgeons see what they want to see. You probably had diverticulitis. Maybe colitis. Crohn's is a serious diagnosis. It's not something you just suddenly have. Dr. Kim walked in then, tablet in hand. Family. I'm Lauren, Tessa's sister. 4th-year medical student at Northwestern. She said it like it meant something. Like it gave her authority. I see. I'm Dr. Kim. I performed Tessa's surgery. She pulled up imaging on her tablet. This shows the section of colon we removed. You can see the transmural inflammation, the cobblestoning, the fistula formation, all classic Crohn's pathology. Lauren barely glanced at it. Could also be consistent with acute colitis. Crohn's is usually diagnosed over time, not from one surgery. Usually yes. But the pathology is definitive. And Tessa's been symptomatic for years according to her history. Dr. Kim's voice was patient but firm. She has Crohn's disease. If you say so. Lauren shrugged. Tessa's always been dramatic about stomach stuff. I'm just saying there might be other explanations. My parents nodded along. Mom patted my hand. You'll be fine, sweetie. Just avoid trigger foods and stress. You'll probably never need treatment after this. They left after 20 minutes. I had a drain in my abdomen, a bag of my own shit attached to my stomach and 30 staples holding me together. They went to dinner at Lauren's favorite restaurant to celebrate her matching into residency interviews. My best friend Mira came instead. Stayed for hours. Helped me to the bathroom. Didn't flinch at the colostomy bag. Your family is insane, she said, adjusting my pillows. They think I'm dramatic. You had emergency surgery for a perforated colon. That's not dramatic. That's a medical emergency. But to my family I was always overreacting. Every hospital stay was an event I was creating. Every symptom was exaggerated. Even now, with proof cut out of my body and sent to pathology, they didn't believe me. The Crohn's diagnosis meant medication. Serious medication, biologics, immunosuppressants, drugs that cost thousands and required careful monitoring. It meant regular colonoscopies, CT scans, blood work. It meant accepting that my body was at war with itself. It also meant more hospital stays. Flares that wouldn't respond to outpatient treatment. Infections from immunosuppression. Side effects from medication. Each stay my family's patients wore thinner. Again. Lauren said when I texted that I was being admitted for a severe flare 6 months after the perforation. Tessa, this is getting ridiculous. Either you're not taking your medication correctly or you're making yourself sick with stress. I was taking my medication exactly as prescribed. My body just didn't care. The family reunion was 1 year after the perforation. My cousin's wedding in Michigan, everyone gathering for a long weekend. I almost didn't go. I was mid-flare struggling, but the guilt from missing family events was worse than the pain. I showed up pale and thin, having lost 20 pounds I didn't have to lose. The colostomy had been reversed, but I still had Crohn's, still had symptoms, still struggled to eat without pain. Lauren held court at the rehearsal dinner, entertaining relatives with medical school stories. I sat quietly, pushing food around my plate. Tessa barely eats anymore, Aunt Carol observed. Are you okay, honey? Before I could answer, Lauren laughed. She's fine. He's just dramatic about food. Thinks everything upsets her stomach. I have Crohn's disease, I said quietly. She had some colon issues last year. Mom interjected smoothly. All fixed now. She just needs to manage stress better. I have an inflammatory bowel disease. It's chronic. It's not fixed. Tessa, don't start this at dinner, Dad warned. But Lauren was already going. Oh my God, are you still saying you have Crohn's? Tessa, you had acute colitis one time. That doesn't make you chronically ill. I have pathology reports. From one surgery. One data point. Do you know how many GI issues present similarly? You're fixating on a diagnosis because you like the attention. The table had gone quiet. Relatives watching. I'm on Humira, I said. Biologic therapy. For Crohn's disease. Lots of things are treated with biologics. Doesn't mean you have Crohn's. Lauren was enjoying this now, showing off her medical knowledge. You know what I think? I think you had bad colitis, got scared and convinced yourself you're sicker than you are. It's health anxiety. Very common. You should see a therapist. My gastroenterologist. Your gastroenterologist sees Crohn's in everything because that's their specialty. It's confirmation bias. She looked around the table confident. This is what they teach us in medical school. Question diagnoses. Don't just accept what one doctor says. Tessa needs a second opinion from someone objective, not a GI specialist with a hammer who sees every problem as a nail. I stood up shaking. Excuse me. I spent the rest of the rehearsal dinner in my hotel room crying, Googling, do I really have Crohn's, even though I knew better. Even though I had surgical reports, pathology, endoscopy results, medication records. Lauren's confidence made me doubt reality. Mira called when I didn't answer texts. Are you okay? Lauren told everyone I don't actually have Crohn's. That I'm dramatic and anxious. Lauren's a fucking medical student, not a doctor. And she's definitely not your doctor. She made it sound so reasonable, though. Like maybe I did convince myself. Tessa. So. You have Crohn's. Your surgeon said so. Your gastroenterologist said so. Your pathology said so. Lauren's opinion doesn't matter. But it did matter somehow. He was family. He was almost a doctor. And she was absolutely certain I was wrong about my own body. The wedding weekend continued. Every family gathering, someone mentioned my health drama or my hospital stays with air quotes and knowing looks. Lauren had effectively convinced everyone I was a hypochondriac. At the reception, my cousin asked innocently, "How are you feeling, Tessa? Your mom said you've been having a tough time." "She's fine," Lauren answered for me. "Just stressed." "Right, Tessa?" I said nothing. I was learning that silence was easier than fighting. What I didn't know, what none of us knew, was that Dr. Rachel Kim, my colorectal surgeon, served on the residency selection committee for several Chicago area surgery programs, including the program where Lauren had her top interview. I found out later, much later, how it happened. Lauren's interview was in March, nearly 18 months after my surgery. She walked in confident, polished, ready to impress. The panel included Dr. Kim. Halfway through, Dr. Kim asked a question. "Tell me about a time you had to reevaluate a diagnosis or treatment plan based on new information." Lauren had an answer prepared. Something about a patient in her clinical rotation, reassessing based on lab values, very textbook. Interesting, Dr. Kim said. Now tell me about your sister. Lauren's face went blank. My sister. Tessa Harrison. I performed her emergency colectomy 2 years ago. You were listed as her emergency contact, since your parents couldn't be reached immediately. Oh. Right. That was... Yes, Tessa had some colon issues. She had a perforated colon from Crohn's disease. She nearly died. Well, the diagnosis was questionable. Acute colitis more likely. The pathology was definitive. Transmural inflammation, granulomas, fistulizing disease. Classic Crohn's. Dr. Kim's voice was neutral, professional. You told her it was anxiety and stress. I was concerned she was fixating on a diagnosis. You told her GI specialists see Crohn's in everything due to confirmation bias. You told her she needed therapy, not treatment. You told your family she was dramatic and attention-seeking. The room was silent. I have notes, Dr. Kim continued, pulling up her tablet. From Tessa's post-op appointments. Documenting family pressure to stop medication. To stop follow-up care. To stop making hospital stays into events. Your words, according to Tessa. Lauren's face was red. That's taken out of context. Is it? Because I also have notes from her emergency admission 6 months post-op. Severe flare, dehydration, sepsis risk. She delayed coming to the ER for 3 days because her family told her she was being dramatic. She nearly died. Again. Another panel member spoke up. Ms. Harrison, you're applying for a surgical residency. Surgery requires recognizing when patients are seriously ill. Your own sister had a life-threatening condition, and you dismissed it as anxiety. I was still in school. I didn't have complete information. You had a surgeon's operative report, Dr. Kim said. You had pathology results. You had your sister's lived experience. You chose to believe none of it because it didn't fit your narrative. The interview went downhill from there. Match day came in March. Lauren didn't match. Not at her top choice, not at any choice. She soaped into a preliminary medicine position at a community hospital, not the surgical residency she'd dreamed of. He called me crying. I didn't match. I'm sorry. It's not fair. My scores were perfect. My letters were great. I don't understand. I said nothing. One of the programs, the interviewer asked about you. About your surgery. Tessa, what did you tell them? I didn't tell them anything. I didn't even know you interviewed there. She had notes. About me dismissing your diagnosis. About family pressure. How did she have that information? Maybe from my medical records. Doctors document things. You gave them permission to access your records? No. But doctors talk to each other, Lauren. Especially when a medical student tells a surgery patient to ignore their surgeon's diagnosis. She was quiet for a long time. You did this on purpose. I had emergency surgery. I nearly died. Twice. You told everyone I was faking. I was trying to help you not fixate on illness. I have Crohn's disease. I'm not fixating. I'm treating a real medical condition that you refused to believe existed. You cost me my residency. No. You cost yourself your residency by dismissing a serious diagnosis and documenting it for the world to see. She hung up. My parents called next. Furious. I'd sabotaged Lauren's career. I'd dragged family issues into her professional life. I'd been vindictive and petty. She told everyone I was faking Crohn's, I said calmly. At family events, to relatives, to my face. She convinced you I was dramatic and attention-seeking. She nearly killed me by making me afraid to go to the ER when I was septic. That's not fair, Mom said. Lauren was just concerned. Lauren was wrong. And now she's facing consequences for being wrong. That's not my fault. Dad's voice was cold. We raised you better than this, Tessa. Family supports family. You should have protected your sister. She didn't protect me when I was dying. I hung up. The aftermath was messy. Lauren eventually matched into a psychiatry residency. Ironic, given how many times she told me I needed therapy instead of medical treatment. We don't speak anymore. My parents maintain she was just trying to help, and I'm holding a grudge. They still sometimes slip and call my hospital stays events, or suggest I'm stressed rather than sick. But Dr. Kim still sees me for follow-ups, even though colorectal surgery isn't really my primary issue anymore. She checks in, asks how I'm doing, makes sure my GI team is managing things well. Your sister, she said at one appointment, made a fundamental error. She prioritized being right over helping her patient. That's a dangerous quality in a physician. Do you think she'll be a bad doctor? I think she'll be a doctor who struggles to admit mistakes, who might dismiss patients who don't fit her expectations. Dr. Kim closed her laptop. But maybe this will teach her humility. I hope so, for her future patients' sake. 3 years post-perforation, my Crohn's is relatively controlled. I still flare. I still need medication monitoring adjustments. But I'm alive and I have a medical team that believes me. And I learned something important. Family loyalty doesn't mean accepting medical gaslighting. Sometimes protecting yourself means letting someone face consequences for harming you, even if that someone is your sister. Lauren's friends from medical school sometimes ask me what happened. Why she didn't match into surgery. I tell them the truth. She dismissed a serious medical diagnosis in a family member and documented it thoroughly enough that surgical programs decided she lacked the judgment for their specialty. Some think I'm harsh. Some think she deserved it. I think she nearly killed me with her arrogance, and the fact that I'm her sister doesn't make that okay. The scars on my abdomen have faded to thin white lines. The emotional scars took longer, but they healed too mostly. I don't go to family reunions anymore. Don't subject myself to people who think chronic illness is a choice or a personality flaw. Instead, I have friends who believe me. Doctors who treat me. A life built around people who understand that sometimes your body betrays you, and that's not dramatic. It's just true. Lauren got her second chance in psychiatry. I hope she's learning to listen to patients instead of dismissing them. But that's her journey now, not mine. Mine is learning that surviving isn't just about living through the perforation. It's about living through the people who told you the perforation was your own fault, that you should have been less stressed, less dramatic, less sick. I survived both. And that's enough.